Did you know that the clitoris is actually very much like the penis in men? I'm Dr. Julie Smith, and today I'm going to share with you 5 things you probably didn't know about female genitalia. If you're new here, I create content about sexual health and psychology every week, so if you find this useful, make sure to subscribe and share it with your friends. The first thing you might not know is that the clitoris is like the penis. In fact, they are what we call homologs. That means that when we are developing as a fetus, the clitoris and penis begin as the exact same structure. As the fetus develops, it will become either a penis or a clitoris depending on whether the fetus develops as male or female. Both have almost identical structures. They both contain corpora cavernosa, which are areas that fill with blood and expand when aroused, and they also extend in size. For years, researchers believed the clitoris had about 8 zosin nerve fibers, but a more recent study from Oregon Health and Science University looked more closely at clitoral tissue under the microscope and discovered it has around 10 zosin nerve fibers on average. That means it is extremely sensitive and, interestingly, the only known organ in the human body that is purely designed for pleasure. That brings us to number 2. The clitoris has a foreskin. This is called the clitoral hood or prepuce, and its purpose is to protect the clitoris from irritation or infection. It works in a similar way to the foreskin of the penis. Sometimes, the clitoral hood can trap oils or dead skin cells, which can lead to inflammation, pain, or even adhesions between the clitoris and the hood itself. This is similar to what happens in men with smegma, which can cause discomfort and sometimes interfere with erections. In women, this can sometimes create no symptoms at all, but at other times it can cause pain when the clitoris is touched or make it more difficult to experience orgasms. There is a simple in-office procedure called clitoral adhesiolysis that can release the clitoris from the hood, although not a highly studied treatment. In one study of 41 women, the results were promising. Around 76% reported less pain, and 63% said their sexual arousal improved. Overall, the majority said they were more satisfied with sex and with the decision to have the procedure. Number 3. The labia minora, or inner lips of the vagina, are unique to each person. They are like fingerprints. They vary in shape, size, thickness, and color, and no two people are exactly the same. Many of the images we see online, especially in pornography, are digitally altered to look a certain way, and this has created unrealistic ideas of what is normal. In reality, many women have labia minora that extend beyond the outer lips, and some are asymmetrical, meaning one side may be longer than the other. During sexual arousal, the labia minora can actually increase in size 2 or 3 times more than usual, and they can also change color. They may shift from a pink tone to a deeper red right before orgasm. These changes are completely temporary, and everything returns to normal afterward. Number 4. The vagina can change in both width and length when preparing for sex. The vaginal walls send signals to the brain saying, "We're ready." As a result, the body begins to produce natural lubrication, and the vagina increases in both width and length. In a non-aroused state, the vagina is usually about 3 to 4 centimeters wide and 8 to 9 centimeters long. But when aroused, this can almost double in size so that it can comfortably accommodate an erect penis. Afterwards, everything goes back to its usual state. This is why the idea of a vagina becoming loose from sex is a myth. The body is designed to be adaptable and resilient. And finally, number 5. The vagina is self-cleaning and has its own protective bacteria. The vaginal environment is unique. Because of estrogen, it naturally maintains an acidic environment that supports healthy bacteria, which protect against infections and harmful bacteria. If you often experience yeast infections, bacterial infections, or frequent urinary tract infections, it can be a sign that something is disrupting the vaginal microbiome. One effective treatment for preventing recurrent urinary tract infections, especially in women who are post-menopausal, have had surgery, or take medications that reduce estrogen, is vaginal estrogen. This can help restore balance in the vaginal environment. It's also important to understand that the vagina does not need to be cleaned on the inside. It does this job on its own. Touching or trying to wash the inside of the vagina is not recommended. If you want to clean around the area, just use warm, soapy water on the outside, focusing only on the hair-bearing areas. The vagina itself will take care of the rest. It doesn't need to smell like flowers, vanilla, or anything else. It has its own natural smell, and that's exactly how it's meant to be. I hope you found this helpful and reassuring. Your body is extraordinary, and everything about it is there for a reason. Always remember to take care of yourself, because you're worth it.